In Rhode Island, these
started a little late, guys, but the news for the virus stuff getting pretty bad.
Passengers' tickets. Anyone who has been to New York told to quarantine for 14 days. The governor also ordering
this blocking
National
who it
Guard to
is,
go
so it's
door
not
to door,
copyright.
looking for people who have traveled to New York, collecting their contact information, asking them to self-quarantine as well. And state troopers stopping drivers with New York plates.
Folks from New York present a different kind of danger to the people of Rhode Island. I know this is unusual, I know it's extreme, and I know some people don't agree with it.
The virus striking around the country. In Illinois, more than 450 new cases and 13 deaths, including an infant.
If you haven't been paying attention, maybe this is your wake-up call.
The McCormick Place Convention Center in Chicago set to be transformed into a 3,000-bed hospital for coronavirus patients. In Louisiana, another hotspot, more than 3,000 cases and more than 130 people dead. Mardi Gras held in the state just a few weeks ago. The mayor of New Orleans says she would have canceled the iconic parades if there would have been more guidance from the federal government at the time.
When it's not taken seriously at the federal level, it's very difficult to transcend down to the local level in making these decisions.
In Los Angeles, officials implemented even more restrictions, closing most hiking trails and beaches. Offshore, one of the Navy's floating hospital ships, Mercy, starting to admit patients with ailments other than the virus today. The Comfort sailing toward New York, bringing 1,000 beds. The governor announcing today 4 new emergency medical facilities like this one at the Javits Center will be built.
All right, Stephanie Ramos joins us now from New York. And Stephanie, I want to go back to the president's comments about possibly quarantining parts of New York, New Jersey, and Connecticut. When the president first made the comments, it surprised some of the governors of those states.
Absolutely, Tom, and there are still a lot of questions tonight. New York's Governor Andrew Cuomo says a multi-state quarantine would not be legal and that it would be more of a lockdown. And Connecticut's governor, who says he's been in touch with Cuomo, he says he wants to speak to the president about this, afraid confusion could lead to panic. Tom.
Stephanie Ramos with those breaking developments tonight. Stephanie, thank you. Now, the critical shortages at hospitals across the country. Mayors say more than 90% of U.S. cities don't have an adequate supply of test kits or masks, and of course those ventilators are in high demand. Doctors and nurses say they feel as if they're choosing sometimes between their patient safety or their own. Here's ABC's Trevor Ault.
Tonight, officials' desperate calls for more ventilators are growing louder. The president enacting the Korean War-era Defense Production Act, ordering General Motors to manufacture the much-needed medical equipment. In the hard-hit state of New York, the governor says they'll need 30,000 ventilators, and should they not get them, they may have to resort to what are called bag valve masks, essentially handheld ventilators that require a person to continuously pump them.
We're very frightened it's going to get worse.
Dr. Roland Weitzpack is the ER director at East Jefferson General Hospital near New Orleans, and he says they're running out of space.
We have seen more and more critical
They're calling for tens of thousands of ventilators and they're just putting them in a storage unit.
Already in Queens,
in New York.
This video posted on Facebook showing a packed
The guy
emergency
admitted
room
yesterday,
lined
Como
with
or
patients on hospital beds,
Chumo, however you
doctors
pronounce
and
it, how you
nurses
pronounce it.
desperate to treat them. And tonight, more than
Como?
90% of mayors nationwide say they don't have
New
enough
York
masks
governor
or
is
test
saying that
kits.
he needs thousands
Nurses
and
say
thousands
they
of
don't have
ventilators
the
and he's just
personal
putting them in a
protective
storage
equipment
unit.
necessary to keep themselves safe from the virus.
Get your fingers out of your
It puts us in
mouth.
a position where sometimes we have to choose between our safety and our patient's safety. And that's not okay.
Sean Petty, an ER nurse in the Bronx, says he's forced to use the same mask for a week.
We're trying to take precautions, but with such widespread infection that can be transmitted in so many different ways, and because of our lack of protection, we are being exposed.
This nurse posting her anguish on social media.
This is truly scary and nobody is taking it seriously.
She says her hospital's not only short on masks and other protective equipment.
We're out of Tylenol. We're out of Tylenol. I don't know what I can do to save people anymore.
The family of 48-year-old nurse Caius Kelly says he worked on those dangerous front lines. He tested positive for COVID-19 and died days later from the virus. His sister saying if he had adequate equipment, he might still be alive.
If you're not protecting, if you don't have the PPE, you are rationing out gowns and masks and, locking stuff up. Yeah, I think it could have been prevented.
The fear of infection extending to the families of healthcare workers. Arkansas Dr. Jared Burks hoping to protect his young son, getting as close as they can to touching hands.
That
Tried calling
photo
her,
completely and
text, saying they
totally
can't call her,
demonstrates
can't answer
the
your
love
phone,
that my
talking
husband has
so.
for us,
Gonna
honestly.
take a nap, love you.
A powerful image there, a reminder of the
Yeah.
sacrifices being made. Trevor All joins us now from the Javits Center, where a makeshift hospital will open on Monday. And Trevor, Governor Cuomo revealing a bit of positive news, but we have to be careful here. It's about the rate at which people are being hospitalized, and maybe more importantly, the rate at which people are going into the intensive care units.
Oh, that's right, Tom. Governor Cuomo reports the number of new hospitalizations and new ICU admissions both went down in the past 24 hours, but he was quick to point out one day does not make for a trend, and the peak of this virus is still likely 14 or 21 days out. And also, Tom, a note from the hospital of that Michigan nurse who says she only has one mask for the year. The hospital says they follow CDC guidelines, including in their conservation methods of protective equipment. Tom?
All right, Trevor Alt for us tonight. Trevor, thank you. Growing concerns tonight about young Americans, many thinking they may be unaffected by the coronavirus. In fact, the CDC reporting 1 in 5 cases involves patients between the ages of 20 and 44. Some patients now warning others their own age they are very much at risk. Here's ABC's Kaylee Hart.
Tonight, Miami reporting its first death from COVID-19.
It's just not fair to die like this.
At 40 years old, Israel Ferreira was fit and healthy. But days after attending a dance party on the beach, he developed a fever and cough. Soon, he had trouble breathing. After 9 days in the hospital, his life was suddenly cut short. His boyfriend says Carrera had high blood pressure, but no other known underlying health issues.
We're seeing young, previously healthy people get critically ill and even die of this infection.
The CDC says 1 in 5 confirmed cases is someone between the ages of 20 and 44. In Georgia, 28-year-old Tarika Parks lives to tell about her fight with the virus.
And I was becoming so weak, I felt like I couldn't fight anymore.
Tarika is part of a growing number of young people battling the virus.
Those sacrifices on my lungs whenever I was able to breathe.
I was a healthy 39-year-old man fighting for his life on a ventilator.
These stories harrowing, but the vast majority of coronavirus cases are mild. Here's what I experienced just before testing positive 2.5 weeks ago.
Congested, got a headache right here, these aches all over my body, particularly my lower back, that just aren't normal.
My condition started improving the next day.
Kaylee Hartung joins us now from Los Angeles. Kaylee, we're so happy you're healthy now, you're able to report. You have that unique perspective having battled the virus. What's the one piece of advice you would give to our viewers who may be dealing with COVID-19 right now, but are being advised to stay at home because doctors feel they don't need to be hospitalized?
Tom, that's the position I was in. My doctor told me to rest, hydrate, and to take a pain reliever as I needed for my headache and those body aches. What's most important in these mild cases is to stay home, to isolate, and to take that order seriously. Tom.
Kaylee Hartung, our own Kaylee, who's been battling the COVID-19 and now is so healthy. Kaylee, thank you for that. We move on now to President Trump and the apparent rift growing with some governors critical of his response to the outbreak. Michigan, now the 15th state to be declared a disaster over the virus. The president saying states should be more appreciative, sparring with some governors he feels are not showing enough gratitude. ABC's Rachel Scott is at the White House.
Appearing with his coronavirus task force, President Trump had this message for the nation's governors.
I want them to be appreciative.
The president calling out Jay Inslee and Gretchen Whitmer, the governors of 2 states hit hard by the coronavirus.
Well, I think we've done a great job for the state of Washington, and I think the governor is a failed presidential candidate, as you know. Michigan, all she does is, she has no idea what's going on, and all she does is say, oh, it's the federal government's fault.
Both Democrats have criticized his administration's response to the pandemic.
I can't afford to have a fight with the White House, but the fact of the matter is, at some point, we're going to have to analyze where all the failures were.
I think it would be very, very helpful if the federal government could be more assertive and aggressive and more organized in helping all of us to obtain these systems.
The president telling the vice president not to bother with them.
And I say, Mike, don't call the governor of Washington. You're wasting your time with him. Don't call the woman in Michigan?
Yesterday, Whitmer said Michigan's pleas for crucial supplies were coming up empty.
What I've gotten back is that vendors with whom we had contracts are now being told not to send stuff here to Michigan.
Today, Whitmer saying the vice president did call, and the state received more than 112,000 of those vital N95 masks from the national stockpile, with 8,000 more on the way. In a video message, she showed her appreciation.
We're grateful to FEMA for that, grateful to the White House for the disaster declaration. We're working 24/7. There is much work to do, but this is good news.
And Tom, an update tonight on those checks to Americans. The White House has indicated that Americans could see that relief as early as April 6th. Now, if you have direct deposit set up with the IRS, that money will go straight to your bank account. Otherwise, paper checks will be mailed out, but that could take 4 to 5 weeks. Tom?
Okay, that is a very important update. Rachel, thank you. Overseas now, those grim milestones across Europe. Italy now topping more than 10,000 deaths. Spain reporting its highest number of deaths since the outbreak began. And the Vatican with news about Pope Francis. ABC's Julie McFarlane is in London tonight.
Tonight in Italy, the number that's hard to believe, but a brutal reality. The death toll passing 10,000. With hospitals overrun, there's a glimmer of hope. Officials are now saying the rate of new cases is decreasing every day. The Vatican testing Pope Francis. He and close aides do not have the virus, but several employees have contracted COVID-19. The Pope is 83 and has one lung. Tonight, the European epicenter potentially moving to Spain. More than 830 dying in a 24-hour period.
This week has been particularly difficult because my hospital is overflowing of patients.
Authorities scrambling to build field hospitals as the number of deaths climbs to roughly 6,000. China sending 4 million face masks to Spain. Here in the UK, Prime Minister Boris Johnson now isolating after being infected. Healthcare workers distraught over the ongoing pandemic.
So in the past week or so, I've seen more deaths than I have done in my whole nursing career so far.
Here in the UK, as the government prepares to roll out more widespread testing, officials announced the total number of dead has now exceeded 1,000. Tom?
All right, Julia, thank you for that. And there's much more ahead of World News Tonight this Saturday. The drug trial's underway that may make a difference in fighting COVID-19. We'll have an update from a doctor who has used the drug combo now being studied. Plus, the tornado watch is issued across several states. The National Weather Service calling it a particularly dangerous situation. Stay with us.
Right back. Yep.
Across the country, Dr. Todd Ellerin is Director of Infectious Diseases at South Shore Health in the Boston area. He's joining us now. And Dr. Governor Cuomo mentioned they gave out thousands of trials of that experimental anti-malaria drug along with the Z-Pak treatment. You were just telling me you used this drug combo on a patient yesterday?
That's right, Tom. The combination we've been using a lot in patients with severe COVID pneumonia, often with poor oxygen levels. We're not using it routinely. Remember, it's looked promising in the lab, but there have been conflicting studies. In France, in a small study, the combination looked good in decreasing the amount of virus in the back of the nose. In Shanghai, they looked at hydroxychloroquine versus placebo. There was no difference between the two. The jury's still out. We need larger trials.
All right, promising results in some cases, but still a lot of work to be done. Dr. Todd Ellerin, Doctor, thank you. And up next, some breaking news. Multiple reported tornadoes touching down. The new images coming in. Stay with us. Now with breaking news, a tornado hitting Jonesboro, Arkansas. Images of damage coming in. Let's get back to Rob Marciano.
Tonight, multiple tornadoes slamming the south. This massive twister caught on camera, tearing through Jonesboro, Arkansas.
Oh, wow.
Widespread damage already seen, destroying buildings, ripping off roofs, and overturning cars. This tire store absolutely demolished. First responders searching for anyone who may be hurt or trapped in the rubble.
Our Rob Marciano reporting on that breaking news. And when we come back, a concert for the soul. Stay with us. Finally tonight, America Strong, the beautiful notes raised here at home and around the world. Here's ABC's David Wright.
Boosted morale, inspiring others. The virus hit closer to home. Now, people are taking it to a whole new level. These are musicians with the Toronto Symphony, performing Copland's Appalachian Spring. Members of the Rotterdam Philharmonic responded in kind with Beethoven's Ode to Joy. The Colorado Symphony did too. Music, universal language. In the face of horror, harmony, humanity, and hope. David Wright, ABC News, New York.
Thanks so much for watching. I'm Tom Yamas in New York. Please stay safe. Good night.
Not a trade spokesperson. This is a paid advertisement for legal services sponsored.
Alright, I wanted to give the most current info. I tried to. So, what I gathered, there was 119,000 cases in the U.S.
Yeah.
And mind you guys, this is probably a week or so behind. Over 2,000 people dead in the U.S. Most cases, as far as the actual flu itself, the COVID-19, we have the highest case globally, from what I understand. And we can't go to the hospital unless we're, like, seriously sick.
Pretty much. If you think you have it, you have to go to your regular doctor or the online version now. And if they think so, then they'll send you to a place
Mavis.
that's testing.
Mavis. Mavis, come here. There you go. You want to be on camera, pretty girl? Hey.
Yes, miss.
Mavis, put your hands down. Look at Daddy. Look at me. Who's that? Pretty lady. Sassy. Come on, Mama. Beautiful girls all around. And their puppies. So, anyways, basically, once you can't breathe, you can go in. Stupid. Flat out stupid. Where we're at, get down. Get down. We're over 100 miles from, we live in Northern California, we're over 100 miles from the southern border of Oregon. We have four cases in our county. That's it. So, yeah, and one case is considered Shasta County, but the guy's in Sacramento being taken care of. So I don't understand that. But like, share, subscribe, please. Guys, stay safe. Wash your hands. I cannot stand my hands being this clean. I've been a mechanic for years. I'm used to them being dirty and calloused. This soft, nasty crap is driving me nuts. So, if I can do it, you can do it. You guys be safe. Stay healthy. God bless. Please like, share, subscribe. Please, please, please. Have a nice day.